only mode.
Hello and welcome to the Rankings in Action webinar series. Today our focus is on income, and my name is Jan O'Neill and I'm a community coach with the County Health Rankings and Roadmaps program. I'm joined here by my colleague Mary Bennett, who is also a community coach.
Hello everyone. I'll be helping to answer your questions as well as sending out some links via our chat box throughout the webinar. We will be recording this webinar and we'll send a link to that recording to all participants after the webinar. You can click on the link posted in the chat box and get the slides if you haven't already received these by email in advance of the webinar.
And we are very excited today to have Nicole Keenan, former Policy Director with Puget Sound SAGE and now with FairWorks, with us today to share the story of how multiple stakeholders came together to help raise the minimum wage to $15 an hour in Seattle. So hello, Nicole.
Hi, it's nice to be here.
It's great to have you. So we'll be hearing from Nicole a little bit later in our webinar. We're going to get started here. So first, we'd like to acknowledge the important relationship we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And we'd like to take just a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, where you'll see our screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. So please feel free to ask questions or share your thoughts and experiences with us via the control panel throughout our webinar today, right there. And we'll be sure to leave time for your questions toward the end of the webinar. And as you listen to this webinar, we invite you to consider these three questions. Who else do you need to share this information with? And what's one idea for action that you're taking away from this webinar? And what else do you need to know to take action and use this information? We'll be coming back to these three questions at the question and answer session with Nicole, so be keeping this in your back pocket as we get ready for that Q&A session later on. And these questions, why do we care about income and what can communities do to impact this focus area, guide our webinar today. To begin, we'll start with a very brief overview of County Health Rankings and Roadmaps, and then we'll dive deeper into the income focus area of our model, looking at the measures we use and why we include them. Then we'll be interviewing Nicole to hear the story of Seattle's campaign to raise minimum wages, and we'll have time for Q&A with Nicole and then wrap up with ways you can learn more about how to take action. So let's just pause for a moment to find out what you're doing to address income and poverty in your community. Mary's just posted a question in the chat box, and we want to give you a moment to respond to that in the chat box, or question box back to us. We'll just take a few moments for this. And as we're waiting for responses here, and please do be sure to include your community so we can share with others on this webinar. We have a number of different places represented, and Mary's going to be pulling out one or two questions to share, so, or not questions, but things that you all are doing. So give you just another moment. Okay, and we'll stop.
So we've had some great responses. So we know that there's work going on in this area in Boone, North Carolina with the Circle of High Country and United Way Vision Council. and also work with the circles out of poverty in Kansas. And I'll be chatting out other responses so that you'll be getting that information throughout the webinar.
And I do want to note that we had a question about whether a state has successfully increased the minimum wage. So perhaps we can bounce that around a little bit during the Q&A section as well. So thank you very much for your responses there. That's great. So what I'm going to do right now is just start with a quick sort of 5-minute brief overview of the County Health Rankings and Roadmaps program to ground our discussion about income. And if you're newer to us, this is going to give you a high-level overview of our program. And to learn more, we encourage you to check out one of our Rankings and Roadmaps 101 webinars. And Mary's going to chat out a link to our most recent recording. So the County Health Rankings ranks the health of nearly every county in every state. This image shows the relationship between policy, health factors, and health outcomes. It illustrates why it's important for communities to take a broad definition of health. Many factors impact how well and how long we live. Things like how we commute to work, housing conditions, access to parks, the quality of our schools, access to healthy foods, community safety, and our social connectedness all impact our health outcomes. So what this image tells us is, starting from the bottom, we know that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. And these health factors, specifically the ones that we look at, are health behaviors, clinical care, social and economic factors, and the physical environment. And we measure 2 types of health outcomes to show how healthy each county is: the length of life and the quality of life. And today we're going to focus on income, which is one of the focus areas in social and economic factors. So let's take a look at the measures in that focus area for today's webinar. So we're addressing income today because we know that income and poverty matter a lot to health. Unemployment rates are 1.5 times higher in the least healthy counties, and in healthier counties, there are fewer children living in poverty. Poorer families and individuals are more likely to live in inadequate housing in unsafe neighborhoods, often with limited access to healthy foods, employment options, and quality schools. And the ongoing stress and challenges associated with poverty can lead to cumulative health damage, both physical and mental. Wealth helps cushion and protect us in times of economic distress. If we're wealthy, we tend to be healthy. And when income decreases, so does health. The rankings shine a spotlight not only on lack of income or poverty, but also differences between income levels or income inequality, because both of these have an impact on health. We use 2 measures in our rankings to assess income. Children in poverty is percentage according to the federal poverty threshold. We use this measure because children are particularly vulnerable to the adverse effects of the lack of income. Secondly, income inequality is the ratio of household incomes at the 80th percentile level compared with household incomes at the 20th percentile. We added this measure this year because of the growing understanding that not only is the average level of income in a county important, but also the distribution of that income among households. Let's first take a look at the national trends for children in poverty. The percent in U.S. counties has been steadily rising since 2002. Among counties in the U.S., the average rate of children living in poverty was 24% in 2013. Rates of children in poverty are more than twice as high in the unhealthiest counties in each state as they are in the healthiest counties. So what does this look like at a county level? As an example, let's take a look at the snapshot for King County, Washington, where Nicole is based. First, we'd go to the social and economic factors section of our website to find our county snapshot and go to that factor section to find the measure. And in King County, we see that 16% of children live in poverty, but we know that that doesn't tell the whole story. You can also see there's trend data available, which shows that this number has been getting steadily worse over time. Now let's take a national look at our measure of income inequality. The higher the inequality ratio, the bigger the gap between the haves and the have-nots. Income inequality ratios are highest in counties with large metropolitan areas and those located in the southeast and southwest, as well as part of Appalachia and the plains. So let's look at this at the county level again. In King County, the income inequality ratio is 4.6, meaning that the income of households at the 80th percentile is 4.6 times the income of households at the 20th percentile. In addition to the two measures used for the income ranking, we also have two additional measures related to income that aren't included in our rankings. Median household income is the income at which half the households earn more and half the households earn less. Since this measure is strongly correlated with children in poverty, we don't include it as a ranked measure. We include children eligible for free lunch as an additional measure because eligibility for free lunch in public schools is a way of measuring the effect of poverty on children. You can find more detail about these measures and all measures either by going to the Measure tab at the top of your state landing page, which you can get to by clicking on your state on our home site, or by clicking on a measure directly from your snapshot. And during this whole part of my presentation here, Mary's been avidly typing away and chatting links. So she's chatting links to the Key Findings Report for 2015, which will give you some of those national comparisons and so forth. And we will be publishing this on our website too, all of the chat links. So at this point, without any further ado, I'd like to introduce our wonderful guest, Nicole Keenan. And Nicole recently joined the Fair Work Center in Seattle, Washington. She brings 12 years of experience in research, advocacy campaigns, civic engagement, racial justice organizing, social services, and community and business outreach. Prior to joining the Fair Work Center, Nicole served as the policy director at Puget Sound SAGE, where she led the policy and analysis work on labor standards and environmental justice. And here's the part that I really love about her bio. In 2015, in addition to all the other things, get this, Nicole was named as one of the 15 people who should really run Seattle by the Seattle Metropolitan Magazine. So Nicole will be talking with us about the work she did with Puget Sound SAGE just prior to joining Fair Work Center. Welcome, Nicole.
Hello. Thanks for the glowing introduction. Before we move on to the next slide, I just would love to point out in the picture that you have there, I love that you have this one, the neighborhood where it's flat just before the sky rises is Chinatown. That's actually my neighborhood. And it's one of the neighborhoods that has some of the highest amount of health risk factors as well as at risk for displacement and gentrification in Seattle. So it's just really great that that was the particular picture you picked out. So if you could go to the next slide, I'll talk a little bit about Puget Sound SAGE, what the organization does, and tell you all about CTAC. So SAGE's mission is to build a community where all people thrive. And when I was there, and they still do this, they focus a lot on communities with a number of overlaying risk factors. Communities that have high exposure to environmental degradation, communities that have typically low-wage jobs or lack of access to jobs, lack transportation infrastructure, and with a real focus on racial and social equity. Some of the campaigns that SAGE has moved and is moving and has won include paid sick and safe time in Seattle, minimum wage, targeted local hire. Right now they're working on a Graham Street station, which is increasing light rail access in Seattle, and also a linkage fee, which would increase affordable housing. And in the past, they did this amazing study in partnership with the University of Washington to actually measure exposure to diesel exhaust in communities where we work. So really excited about the work at SAGE. If you could go to the next slide.
And Nicole, I just want to say we also have the vision for Puget Sound
Oh,
SAGE here. So
great.
just want to give people a moment to just take that in and maybe find the words that really speak to them.
Perfect. So I should talk a bit about the living wage campaign in SeaTac, which in our opinion was the first campaign that galvanized 15 across the country. You'll hear a lot about Seattle being the first to move to a $15 minimum wage. And the Seattle movement, in many ways, was galvanized in the city of SeaTac just the year before. So I'll give you about 5 to 10 minutes of context about what we did in the campaign and then talk a little bit about how we won it. So the city of SeaTac is a town about 15-20 miles south of the city of Seattle, and it's where our airport is located. Most people probably think that SeaTac is an airport. There's an actual town called the city of SeaTac. It was formed 20 years after the airport was built and about 20 years ago. There's 25,000 people that live there and 12,000 registered voters. Before this campaign began, there were just 11,000 registered voters, so we actually registered 1,000 voters during the time we were working there, and a majority of the people that live in SeaTac are people of color. The airport itself takes about a third of the land mass of the city of SeaTac, so not only are people there statistically more likely to be poor, but they also have a high number of environmental risk factors with airplanes flying over them on a regular basis. And some of the folks that I talked to actually said their cars were sticky with jet fuel residue. And compared to other cities in King County, they have the highest poverty rates. So earlier you talked about how the poverty rates for children in King County was about 16%. In this data set, we disaggregated the towns surrounding SeaTac Airport, so that's SeaTac, Tukwila, Burien, and any small town that actually touched the airport itself, and disaggregated their poverty rates from the rest of King County. And you can see that a lot of the poverty in King County is concentrated in the towns around the airport. And so we're looking at 16% of people that live near SeaTac Airport live in poverty compared to 9% in the rest of King County. And for children and people who've immigrated here, it's about 1 in 4 people live in poverty compared to the rest of King County. If you could go to the next slide. Here we can see the breakdown of people of color that live in the city of SeaTac. And it's a town that is 60% people of color, with Latino and folks from African descent, either Black or African American or Black. And many of the folks that live in this particular area are actually Somali, Eritrean, and East African identified. Can you go to the next slide? Oh, and I should just mention in that last one, 60% of the people that live in SeaTac are people of color, but have very minimal representation on in their local government. Right now, there's just one person of color that sits in city council. So in this slide, you can see some measures of public health. Again, the airport and airplane pathways cut right through the town, and you can see that people that live in SeaTac report worse health indicators than compared to the rest of King County. 1 out of 4 adults is uninsured, and 15% of the folks living in or around SeaTac could not afford to see a doctor. Could you go to the next slide, please? And so with the multiple layers of problems in that the community faces, environmental risks, high rates of poverty, we wanted to understand and explain, why is this happening? And although this is one contributing factor, we know it's not everything, but from 1990 to 2010, so last 25 years, the per capita income in SeaTac has decreased, and this is all inflated to adjusted to inflation, from $31,000 to about $23,500 per year. And in addition, in that around same time span, the amount of families living in poverty increased from 9.8% to 12.2%. So if you can go to the next slide. So why is this happening? Why did per capita income decline? One of the reasons that we were able to name is that decreasing wages at SeaTac Airport. So in the city of SeaTac, 1 out of every 4 residents works at SeaTac Airport. That's a huge amount of people. And the story goes back all the way to the 70s, but I'll try to make it short, is that until the mid-70s, airlines were highly regulated. The path and the flights that they could take were regulated, but also the wages for people that worked at the airport were also regulated. And the typical wage for a ramp worker at SeaTac Airport, adjusted for inflation, was the equivalent to $25 to $30 per hour. This was a trend that increased. A lot of wages at airports started to decline after the 70s, after the airports and airlines were deregulated, and a number of airlines started to outsource their ramp work to third-party companies. And so ramp workers are the folks that you see here. They're the folks that move your bags, folks that de-ice your planes, fuel your jets. And again, these are jobs with high risk and high risk factors, particularly for jet fuelers and folks that have to get on the planes. So in 2005, the Alaska Airlines, which was the major airline and still is the major airline at SeaTac Airport, fired 500 workers who were making between $15 and $21 an hour with full pensions, full benefits, and told that they could reapply for their jobs at $8.75 an hour, and they lost all of their benefits. This occurrence back in 2005 really, in many ways, galvanized and started this movement. It was a movement to organize airport workers, to provide them support to get the jobs, the quality of jobs that they once had, back to them. So if you could go to the next slide. You can also see that not only did they have their jobs at lower wages, but also their hours were cut. And this is a trend of full-time to part-time jobs nationally. So you can see a national problem of income inequality with the increase of service sector and low-wage jobs, and many of them are part-time. If you can go to the next slide. In addition to lower wages and fewer hours, the amount of turnover at the airport started to increase, as you can imagine. And they experienced a large number of poor working conditions. Folks were being asked to work for 30 minutes before and after their shift unpaid. People were seeing their tips garnished or withheld. Breaks were denied. And one of the more harrowing stories that I've heard came from a compilation of complaints to the Department of Labor and Industries for health and safety violations at the airport. Ramp workers, baggage handlers, people that clean the planes, and people that move wheelchairs experience a number of safety and health hazards. For example, people that clean the airplanes have just a few minutes between flights to rapidly clean the inside of airplane cabins. And they do so often without gloves and using really harsh and toxic chemicals. So without gloves or masks, they're spraying toxic chemicals in an enclosed cabin. In addition, folks that move wheelchairs, one of the stories that I read and actually spoke with this worker, she was moving a passenger in a wheelchair and they had an accident in the wheelchair. And she didn't have any proper equipment to clean the wheelchair up, so she brought it to the public bathroom and washed it with brown paper towels and her bare hands, and then put it back in line to be used again. So if you could go to the next slide. we had a number of different problems that we were working to face at the airport, from poor working conditions, low wages, part-time hours, and we looked to other airports to see what they did to address those issues, because not only is this an issue for the workers themselves, but if the problem gets bad enough, it becomes one for safety of passengers and for public health in general. A lot of the workers that we worked with at SeaTac Airport didn't have paid sick time, and airports are one of the known carriers and places where disease spreads. And so we included a provision for paid sick time and paid time off in the airport. We also included worker retention. Okay, yeah, it's all here. You can go to the next one. We also included worker retention. So if the airline replaced one contractor with another, the workers would be able to keep their jobs for 3 months, so some level of employment security. We included a $15 living wage, which enacted January 1st, 2014. We banned tip theft, and then also encouraged full-time work. So before an employer could hire more part-time workers, they had to offer more hours to the existing workforce they had. So if you go to the next slide, I'll talk a little bit about how we won the campaign.
Yeah, if you, Nicole, this would be great to sort of take us behind the scenes. And I want to just say this was, I just want to comment, this was a long developed movement over time, and so people don't feel overwhelmed in hearing your story. There are many little building blocks along the way that I know you'll sort of comment on all the little elements that came together and highlight those. So how you won the 15 campaign.
Absolutely.
Just sort of highlight those. That'd be great. Thanks.
So this was not a one organization show. There were a number of organizations involved in making a living wage in SeaTac and then a $15 minimum wage in Seattle possible. So there are about 130 different organizations that signed on to the coalition, and it was years in the making. So these organizations had won previous campaigns together in the past, like paid sick and safe time in Seattle in 2012, then together won living wage in SeaTac in 2013. So, don't feel like you have to get all of the pieces together, but I'd love to share how it formed. So one of the more significant organizations that moved a lot of this work is Working Washington, and they work to create living wage jobs, and they did a lot of organizing, particularly among workers at the airport. So that organizing campaign had been going on for 2 to 3 years before we even began the living wage in SeaTac. The role that I played and that Puget Sound SAGE played, me and my colleagues played at SAGE, were the community organizing aspects and the policy and research aspects. So SAGE took on the interfaith and community organizing in SeaTac. Many people are really part of their faith is a big part of their world, and there's a group of existing faith leaders in the community that knew each other well, ran the food banks in the area. One of the ministers, who's you can see her in the rainbow shawl in this photo, ran one of the food banks that was closest to the airport and was regularly seeing airport workers come into her food bank. So people that were working still needing to go for food assistance. And SAGE itself is part of the Partnership for Working Families Network, which is a national network of organizations. There's 17 different ones across the country. Many of you probably have one in your city that was a huge part of the living wage movement that's been going on for 20 years. So they had already won several airport living wages up and down the West Coast. One of the key pieces that I saw in winning 15 was this interlocking of faith organizing, small business organizing, strong policy and research, along with worker organizing. So we really focused on organizing the small businesses in SeaTac to support a living wage, and we ended up with 10% of all of the small businesses in SeaTac supporting the measure. one of the reasons why they did was we went with workers into the businesses and asked them to talk about if they made more money, how they'd be able to buy lunch more often at the small business. So that was one tactic we used on the small business end. On the faith organizing, we built the Interfaith Economic Justice Coalition, which you can see here. And it was a group of imams and Methodist and Episcopalian ministers that came together and worked with their congregations to share the importance of increasing the minimum and living wage in their neighborhoods.
Nicole, could you talk a little bit about your organizing the block to block, how you did that, and how you folded it in with, the signing people up to vote?
Absolutely. And so I can't say I did that, but one of the field lead hired by Working Washington had a number of workers who worked at the airport who lived in their neighborhoods, were assigned a few blocks that they worked every day or every work day for 6 to 8 months. And they really got to know their neighborhoods and their blocks really well. Talked to them about the living wage campaign, talked to them about how it was going to be a ballot measure this coming fall, registered people to vote in their own language. And by the time the ballots came, they already knew the organizers that were going to help them fill out their ballot. And obviously the people filled out their own ballots, but they had an organizer there with them if they had any questions. They had people, ballots actually came 3 days late in CTAC that year. And so we had a huge blitz, and this was something that SEIU did. They brought out 200 organizers from across the country to work with the people who knew their neighborhoods block to block. And so, eventually people had said, no, yeah, we know, we're waiting on our ballot too, we're going to vote for it. Like they were so flooded, and this is a town of, just 25,000 people. So not only did they know the organizers really well, but they were expecting and waiting for their ballot to drop. And because they had built these really strong relationships, there were a number of people in the community where English was not their first language. And for some, it was much easier to share how to vote via a DVD. And so a few of the faith leaders, particularly imams in the community, recorded DVDs about the importance of voting and how to vote. And so because of the relationship they'd built with the organizers, they were able to basically plug in the DVD, watch it, and then be able to vote from there.
And what was the pitch that they gave to businesses? Because, we're actually getting a lot of questions from people about, well, how do you convince businesses that this is good for them?
So it's all, in a lot of ways, it's about the right relationships and the right spokespeople. So we had workers who were regulars at the businesses go in with organizers and talk about how, they're talking about raising this minimum wage or this living wage, and, if I made a little bit more money, I'd be able to come here for lunch every day. And that got people talking. And then if they had extra questions or additional questions about how the law worked or nuances on the policy, the workers called me, and I would go in and talk about, the policy itself. And then if you keep going further down, I would skip 2 slides down, and then we'll go back, but just to the one where there's a bunch of people in Winning 15. Maybe, yeah, that one. So this is actually a shop hop that we did where we were thanking businesses who supported 15 and drove business to them. We visited every business in the community that actively supported, showed workers and people in the community how great the business was, and we'd buy stuff. This is where we ended, and everyone had dinner and drinks. So that was the main way we work to support and get businesses on board. Another is having a business as a spokesperson talk with other business owners, demonstrating how, you know, I raised my wages a little bit higher and I have virtually no turnover and my workers are really happy and more productive. And because, you know, I'm now known as a business that pays people better, people want to come to my business to support me. And we're seeing that time and time again. Even in Seattle, one of the businesses that was somewhat neutral, not a big fan of it, but you know, understood that raising the minimum wage was important. In Seattle, Ivers, which is a pretty well-known seafood place, once the minimum wage increased in Seattle, they saw their businesses vastly increase because they went above and beyond to make it easier for them. Since the phase-ins just made it a little bit logistically confusing, they just raised the minimum wage across the board for everyone in their workplace, and people are actually now tipping more than they did before, and they're seeing, you know, a huge influx of people coming into their restaurant.
So what I'm hearing you say is that you framed it in terms of what was in it for them,
Yes,
as business owners. So, and when Mary has posted the report on economic impact, and that had come out sort of proactively before a big election. Wasn't that sort of strategic on your part?
it was. So in addition to the business organizing, the faith organizing, and the worker organizing, we had a whole research and policy arm to the campaign, which was my main role. And we produced a series of reports in anticipation of opposition framing. So the first one was framing the problem, which is what I did a little bit earlier, talking about the problems of health and safety at the airport. And during that time, there was no opposition to speak of. The campaign hadn't really risen, and as far as Alaska was concerned, they were just thinking it was a bunch of activists. By the time our next report came out, they increased their minimum wage for their workers up to $12 an hour in response. And then before the ballot initiative, we wrote a full-length economic impact analysis of raising the minimum wage. And we used the Bureau of Economic Analysis input-output model, and this is the federal BEA, to demonstrate when you increase household incomes, it creates a ripple effect where people can spend more money in their neighborhood. And we quantified it and showed that raising wages for 6,000 people at SeaTac Airport would increase economic activity in the community by $54 million.
So when, again, just sort of to underscore, it seems like what you're saying is it's a combination of that quantitative data, the research, the what is the real impact, but a lot of times people will just disagree with the numbers if they don't agree with the messenger. So you've built these relationships so that people had trust within the community and trust among the business owners who then supported it, and when there was opposition, those business owners said, wait a minute, we already see this is in our interest. And then you already had the community organized so that they were ready to vote for. You actually put it on as a referendum. And so you had them all organized and lined up as voters, and they were ready to vote it in. Is that
exactly?
So
yes.
This is such a wonderful story. What are your biggest ahas from this experience? What do you sort of take away from this? And I love this, how's the hope going? Can you tell us what that means?
Oh, yeah. So actually, in this photo, you can see 4 panelists. The one on the far left is me. The one in the red is SAGE's lead organizer. And then one of our leading imams, and then one of our leading ministers on the panel. And how's the hope going today is a story that came from the lead organizer in the red. And she had her neighborhood that she was organizing in, and every day, whenever she ran into people, they would ask her, how's the hope going today? Because the community started to refer to SeaTac Proposition 1 as the hope for their community, and really saw it as a way to lift the community out of poverty, since we'd really made the case that with wages declining over the last 20 years, the way to lift SeaTac out of poverty was to lift wages for 1 out of every 4 worker in the neighborhood. some of my biggest ahas were obviously that story. And then there was the DVD where we had the voter registration in language, and really it was just such a phenomenal and relationship-based way to win something really big, getting to know people in their community well enough that you could walk in and show a DVD and talk about what it means to vote and how to vote together and have that resource in language. Another one was organizing based on mutual interests. I don't, as much as I would love to change everyone in the world's minds on anything, you really can't always do that. And so if you want to move people to any issue, you need to organize based on mutual interests. And so the way we organize businesses was really based on what is it that drives you, what is it that drives your business, and how do we make the connection there. And so my favorite is the story of Don Liberty, whose bar we showed you earlier. So his bar is older than the town of SeaTac itself. It's 35 years old, and he is a Republican, pretty conservative, and when I walked in to talk to him, he said some mildly racist things, and but we just got talking about the airport workers, about increases to their wages, which could mean more business for him, and he and I built a really great relationship. He was such a wonderful person by the end, and became the biggest champion for living wages in SeaTac. His bar became the hub everyone went to. We actually saw an uptick in the polling of Republican-leaning voters in support of the living wage after his bar came on board. And he didn't go without threats. He had some threat calls made to his business, and a number of people in the community that supported him rallied around him. People were in his business every day to make sure that he was okay and that his business was thriving. And I think he made quite a bit of money during the period of time at the campaign, because there was just people there all the time, and they had karaoke every night of the week. So, a lot of people went there for that too.
That's great.
Yeah.
What a great story. This is, and I love that you end on with the Don Liberty story. That's wonderful. There have been so many wonderful questions that have come forward. Are you ready for the questions from the audience?
Sure.
Okay. I'm just going to share back again the reflection questions we started with. So if you haven't chatted in a question for us, just be thinking about these, and maybe this will spur you to come up with a question, or just feel free to listen in now. So let's see. Let's open it up now, Mary, to questions. What have we got?
Yeah, Nicole, thanks so much. This is great. So you've talked a lot about the benefits of, building these relationships and making this work happen. We have one question that says, have any businesses closed down as a result of the increase? This is a fear, our person is saying, in the Northeast. Could you comment on that, please?
Yeah, so in SeaTac, as far as I know, I haven't heard of any businesses closing as a result of the living wage increase. There was one hotel that said they were going to fire a number of workers and close up shop, and they actually ended up expanding the number of rooms they had to become more profitable to pay for the minimum wage increase. And there was another hotel that changed their model of their restaurant. So it used to be full service, but I'd been in that restaurant and it was pretty empty, and so they then shifted to more of a cafe style. So there are ways that businesses have adapted for sure, but in terms of closing down, at least in SeaTac, I don't know of a single one.
Well, thanks a lot. And here's another question asking if you can talk about whether this campaign has ever framed as a key way to improve health outcomes and how increasing economic prosperity improves health.
So the health framing that we used during the campaign was largely around health and safety in the airport itself. And talking about, we did mention that increasing wages was important for the health and safety of the community, but we also talked about within airports, if you raise wages for people that work in the airport, the turnover is more likely to go down, and people who are sick aren't going to work at the airport. And so that improves overall public health because you don't have sick people working in the airport. And you have people who've worked in airports regularly, staying in their jobs and knowing the systems, and all of that being overall better for the safety of consumers. And we drew that from a Government Accountability Office study conducted in 2000, where, and this is actually a really telling story. In 2000, GAO put out a report that high turnover at airports is a safety risk, and particularly for the security guards. The security at the two airports where the planes that crashed in 9/11 had a 200% turnover for their security positions, and at the time they were paying about $5 to $6 per hour, and basically said airports need to do something to address this turnover problem. And that's how a lot of the airport living wages came about in the early and mid 2000s. And San Francisco was one of the first to enact that. So we talked about that in our airport, that you also needed to have increased wages at airports, because it's not just the security screeners, but everyone that works in the airport that knows what standard procedure and what isn't.
Well, thanks so much. A couple other concerns that people have shared is, how about the impact for people that are already making $15 an hour and that they then are quote-unquote above those that are now making 15, is how are you dealing with tension in terms of kind of the ripple effect of raising the minimum wage?
So with that particular effect, what we've seen in other cities and are starting to see here as wages go up is that people who are just above that line also see wage increases. And it's just not as much as, so let's say one person went from 10 to 15 and another person was already at 15. Businesses and employers are putting them up to 16 or 17.
All right, and thanks so much, Nicole. And another question from Kansas City is that they're getting some resistance from nonprofits who say they would not be able to increase wages because most positions are grant funded. How did Seattle handle this situation?
Yeah, so in SeaTac, there were no nonprofits that were covered because it was airport specific. In Seattle, we did see this issue come up, and SAGE and I did the nonprofit organizing on this end. We did a couple of different things with nonprofits. One was we worked with the same nonprofits to advocate for increased funding for them at the city. And this is something that the city and county of San Francisco did as well, as when they increased the minimum wage in San Francisco, they, particularly for their nonprofit contracts, agreed to increase their grants to make up for the difference in the minimum wage. Another argument that we saw come up from nonprofits was the idea of the benefits cliff. So what happens for folks that are using public benefits and see an increase in minimum wage? How does that impact their ability to use food stamps, receive a large enough EITC, qualify for public housing? And I went in and looked at a number of different benefits and found that any folks that had dependents would still be eligible for public benefits, and that it would be only single adults who worked full-time and rented studio vouchers would see an impact on their public benefits. But the case that we were making is if you're a single adult and you're working full-time, you should be making enough that's a self-sufficient wage. And that we need to raise the wage to what is a self-sufficient wage. In terms of other pushback from nonprofits, that's something that I think is a real tough nut to crack, but we also need to push foundations and push the federal government as well as local governments to understand that what nonprofit wages are not livable wages, and that paying a case manager, which I used to be one at a transitional home, making $11 an hour, is not a sufficient wage for the importance of the work that nonprofits do. And so how can we partner together to not only raise the wage, but make sure that you're getting funding for that raise, and make the case to funders that paying people substandard wages for really important life-saving work is not adequate.
Thank you again, Nicole. That's helpful information. And just one last question here is, do you have suggestions for strategies to design meetings and gatherings so those workers and families who would be affected by the wage increase could also participate and attend? This person has found that many of the individuals they'd like to work with are already stressed and overwhelmed with multiple jobs and children to care for. Do you have comments on that for us?
Yeah, so again, it's meeting people where they are. So with the interfaith organizing that we did, we met people at church right after church. We met people at food banks when they were going to get food. We provided childcare at all of the events so that there would be an opportunity for their children to be taken care of, as well as food. People had maybe an incentive to come if there was free childcare and dinner. And then we also met people at their homes, and our organizers, again, I was not part of the field organizing team, but our organizers knew that the communities and the people they worked with well enough to know the right time to come by. So again, it's in terms of designing the meetings, it's more about figuring out what kinds of things they already go to, and how do you tack on to that, build momentum, and then when people are already really invested, at that point it makes sense to have different meetings where people attend.
This has been great, Nicole. You really appreciate it. Unfortunately, we're kind of running toward the end of the webinar. We have a couple more questions which we can take offline, and you've been gracious enough to say that maybe you can help us answer some of these.
Absolutely.
So that would be awesome. Thank you so much. So what I promised at the top of the hour, and I want to come back to, is talking about other parts of our program which have to do with what do you do about it, the taking action part. And so we've heard how Seattle is tackling income challenges. How can you begin to start to build some foundations in your own communities, and what are those building blocks? How can you build the momentum? And many of you are already doing this. You've got many pieces in place. We do have on our website examples of communities taking on this issue, from increasing funding for childcare and early education to adopting living wage laws like Nicole has talked about, to children's savings accounts that build college funds from birth, and many more. But in addition to these big P policy changes, if you will, we also want to acknowledge that there are a lot of efforts that communities are engaged in that are having an impact on reducing poverty. For example, there's a bike repair and rental center in Minneapolis in a low-income neighborhood that trains youth how to fix and tune up bikes, and this provides job skills for those youth in repair and also retail skills. In Cleveland, there's a foundation that worked with local hospitals to support development of 3 worker-owned co-ops, and those co-ops are what the hospitals are purchasing their services through now. In rural Mason County, Washington, we actually did a webinar with these folks. Local businesses and schools are partnering to implement career and college readiness curriculum in 4th through 8th grade. Passing a minimum wage law is certainly a big lift, and there's many other things that can be done as well. We want to give you inspiration that there are many ways to go about tackling this complex and challenging issue of poverty in our communities. We also want to share with you that there is on our website What Works for Health, and it can be found under the Roadmaps to Health tab on the County Health Rankings website. So there's two tabs, 2 orange tabs up there. Go to the Roadmaps part and click on What Works for Health. It's a great resource to search for strategies that would make the most sense for your community. And if you search by income, you'll actually find 14 strategies, including 3 that are scientifically supported and 3 that have some evidence of effectiveness. And we aren't going to do a tour of What Works for Health here, but if you click on that play button on the home site of What Works for Health on the home page, there's a 4-minute tutorial on how to use the database if you're not familiar with it, or you can watch the 101 webinar, which includes a tour of What Works for Health. We know that taking action can be really rewarding, but it isn't always easy work, so we also developed a sort of one-stop shop of tools and resources to support communities taking action. So from our site, if you click again on the Roadmaps to Health on the orange bar, you'll see the Action Center, and from there you can go to the Take Action cycle, where you'll find guidance for each step of taking action. And we also want to let you know that thanks to the support of the Robert Wood Johnson Foundation, we have 11 community coaches, 4 of whom are based in Madison, Wisconsin, and the rest are regionally based around the country. And our assistance is available at no cost to you. You'll find these orange boxes located throughout the Action Center, inviting you to contact us for personalized free help. And this is really the best way to contact or connect with one of our community coaches. Please don't hesitate to contact us if you need assistance with the tool, a question, or figuring out the next step in your process. Just having a thought partner to do that can often be very helpful. I want to mention also all the social media ways to stay in touch with us and communicate about county health rankings and roadmaps. And please make sure that you sign up for our newsletter so that you know when our next webinars are coming up, as well as other tools, resources, and various funding opportunities and all sorts of things that are happening in the program. This program is the result of the contributions of many partners, including those listed here. So today we asked, why do we care about income and what can communities do to impact this focus area? And we hope you're leaving with some answers to this question. Perhaps you have some new questions as well. We're very grateful to Nicole Keenan for sharing her time with us today, and thank all of you on this webinar for joining us as well. We look forward to seeing you on our next webinar. Thank you very much. Goodbye.